Okay, so this is a small lecture looking at the nicotinic receptor blocking drugs. There's really two receptor targets. The first one is the nicotinic receptors within the ganglion, and the second receptor family, or we'll talk about, are the nicotinic sub-M receptors that are associated with the neuromuscular junction. Okay, and those can be further subcategorized into depolarizing versus non-depolarizing. Okay, so for the first part, we're going to look at the ganglionic blockers, and these drugs are kind of unique in that they inhibit all postganglionic neurotransmission, and because of their chemistry, they can primarily affect the nicotinic sub-N receptor more primarily, or more powerful than the nicotinic sub-M receptor. But because of this affinity to the nicotinic sub-N receptor, we can block all autonomic outflow. And this is obviously both in the sympathetic but also in the parasympathetic nervous system. And the resulting effect is going to be kind of based on what's deemed the predominant tone of the organ. And so the drugs that we're going to be talking about include hexamethonium, mecamylamine, trimethophan. These really have limited clinical use. They're really kind of used primarily in the laboratory. The only one that's moderately clinically relevant is trimethophan, and that's specifically in hypertensive emergencies, specifically in hypertensive emergencies where other drugs don't work or aren't available, and then aortic dissections. And then there's specific surgical procedures that can be used that will use trimethophan to reduce CNS bleeding. So we're not really going to spend a lot of time on these drugs. There's one learning objective, and it's pretty much just to basically know that these drugs exist. I'm not really going to talk about the differences here. There is one drug that you may have heard of, and that's varenicline, or under the brand name Chantix. This is for smoking cessation. It's not even really in this unit. In terms of this block. So we will come back to this drug specifically when we talk about drugs of abuse and drugs of addiction. But there's really not that much to talk about on these in this particular class. So so this is the anatomic regions we're talking about. These are where these ganglionic blockers work, and you can see that they have an effect on both parasympathetic and sympathetic nerves because nicotinic receptors are found in both. And if you supply many of these drugs or any of these drugs, you block nerve transmission, and it's greatly inhibited in both of these regions. And so, from a clinical standpoint, I mean, there'd be really few instances where it would be a good thing to block all nervous transmission. At least you'd want to separate sympathetic versus parasympathetic, and for the most part, that really isn't accomplished with this drug class. And so I want you to know that these drugs do exist. They have very, very limited clinical use. We can talk about them when we do a specific CNS surgery, when we talk about aortic dissection specifically. But I think it's good to know that they exist, and that the main effect is this really large reduction or inhibition of all nerve transmission. And that's really just the take-home message with this first drug class. The second drug class we're going to spend a little bit more time on. Okay, so I'm going to end the video right here, and we'll talk about the neuromuscular junction blockers in more detail in the next slide.